Hello everyone, I am Dr. Shweta Mishra. I am an obstetrician and gynecologist practicing in Mumbai. As you are well aware of, that pregnancy is the most special and most unforgettable experience in a woman's life. Pregnancy is usually divided in 3 trimesters. The first trimester is from the first 12 weeks. The second trimester comprises from 13 to 28 weeks, and the third trimester comprises from the 29 to 40 weeks, after which the delivery happens in a normal case. So today we would be discussing the first trimester, the normal symptoms, the normal things what occurs in first trimester, what is safe in first trimester, what doubts usually the women have in first trimester, and what is expected in the first trimester. So usually a pregnancy is detected after a woman misses her periods. After she misses the menses, it is usually the woman undertakes a urine pregnancy test by herself, or she visits a doctor who takes a urine pregnancy test, does an ultrasound, or does a blood investigation. So after the pregnancy is detected, what usually is, we usually want to estimate the gestational age of the baby. So for estimation of the gestation of the baby, your doctor would usually suggest a ultrasonography. The first ultrasonography is usually for determining the gestational age. Gestational age means how old is the pregnancy, how old is the fetus. That is a very important sonography which is recommended by your doctor. So what are the common symptoms that a woman experiences during her pregnancy in the first trimester? So in the first trimester, most of the women experience excessive nausea, excessive vomiting. There will of course be weight gain. There could be weight loss in some cases. There is increased frequency of urination. There is a sense of constipation. The woman might have an increased perceiveness of smell. There could be mood swings. There could be mood irritation. These are all the normal symptoms what almost every woman experiences. So to start with, we'll start with the nutritional requirement. The nutritional requirement increases in pregnancy. The normal calorie requirement in a pregnancy is around 1800 to 2000 kilocalorie per day for a woman with a normal BMI. The weight gain which is expected during the entire course of pregnancy should be around 8 to 11 kgs for a normal BMI woman. Okay. So in the first trimester, the calorie intake should increase by around 500 kilocalorie, and the distribution should be such that your meal should comprise of around 50 to 60% of carbohydrates, 20 to 30% of protein, and around 5 to 10% of fats. But it is not advised that you have to have a very strict proportion of meal, or you have to always count your calories. That is practically not possible, and not everybody can go to a dietitian. So the fruit, so what should I eat during the pregnancy? So what is expected is the rich source of protein are of course green leafy vegetable, boiled egg, almonds, fruits, and of course soya bean. Everything can have which will give you a good amount of protein. Pulses. So about the fruit, a lot of women ask this question very commonly to all the gynecologists is, can we have papaya? So let me put an end to this controversy forever, that papaya is absolutely safe in pregnancy like any other fruit. It does not cause any miscarriage, it does not cause any abortion. So you can have papaya as much as you like any other fruit. So this was about the myth related to papaya. The next thing is, there is what your doctor usually advises the doctor will start you on tablet folic acid. Folic acid ideally should be started when you're planning pregnancy, even before you have got pregnancy. It is because it is for the neurodevelopment of the growing fetus. So folic acid has to be taken throughout the first trimester at least. It should be started as soon as the pregnancy is detected, and should be continued for the entire first trimester till 14 to 15 weeks. Because the woman is usually having increased symptoms and everything, Then the woman usually asks us, should we do have a bed rest or anything? Bed rest is not recommended in a normal routine pregnancy unless the woman is having any complication. A woman, however, should have around 6 to 7 hours of sound sleep in the night and a 2 hours of sleep in the day. She should have a good 8 to 10 hours of sleep for the entire course of 24 hours. She should avoid lifting heavy weight. Heavy course workout is also not advised in first trimester, but a 30-minute walk or some amount of aerobic exercise is acceptable and is actually good. Traveling. Taking long flights. Usually women are very anxious about, should we do air travel? I have to go somewhere but I'm already pregnant. Can I take a flight? Is it safe? Taking a flight is safe in pregnancy, but taking a very long hour flight for more than 4 hours is usually not advised. But in case due to unavoidable circumstances, a woman has to take a flight, then she should make sure that there is constant mobilization of her feet, or she can wear a elastic compression stocking, or she can move in the flight in every half an hour to 1 hour with, of course, with some assistance. Another most commonly asked question, which a lot of women might not ask or might not be comfortable asking, is can we have intercourse, that is, can we have sex during pregnancy? A woman can have sex during pregnancy. Sex will not cause any harm to the baby. The baby is very well protected in the amniotic fluid and in the uterus, and sex will usually not cause any harm to the pregnancy. Of course, sex is avoided, and in certain circumstances, like if you're having a low-lying placenta, if the patient is having a preterm labor, if she has had an increase of any other complication. But in a normal routine pregnancy, sex is absolutely not going to cause any harm. So now, what blood investigation and sonography, or what test usually your doctor would recommend in the first trimester? In the first trimester, sonography, two sonographies are important. One is for estimation of gestational age, as I've already said, which is usually done after you detect a pregnancy. The second, which is the most important scan of the first trimester, is the NT scan. NT stands for nuchal translucency. It measures the nuchal translucency is the area beneath the neck of the baby, which the sonologist will measure. It usually is for detecting any anomaly if the baby might have. It is the first step of detection of any anomaly in a baby if in the first trimester. Along with it, many gynecologists also prefer to give a double test, that is double marker test, which will help you detecting any anomaly if the baby is having like any aneuploidies like Down syndrome, Turner syndrome, all these syndromes. Blood investigation. The blood investigation which is usually needed in the first trimester of pregnancy is a hemoglobin estimation, a thyroid estimation, your blood group estimation. These three are the most basic blood investigation which is needed in all the pregnancies. And of course, if a woman is having any pre-existing disorder like diabetes, so a sugar estimation or any other condition if she having, that will of course vary with different women. But in a normal healthy woman, these three are the tests which is usually done in the first trimester. Now, warning signs. What are the warning signs in pregnancy? The warning signs in the first trimester of pregnancy are if the woman is having any excessive pain, if she is having bleeding, or if she is passing clots, or if there is excessive vomiting which is leading to weight loss, or if it is troublesome, and she is not able to carry out her day-to-day activity, then she should definitely consult her gynecologist. Okay, so I think I have pretty much answered all the queries which the women have, and I hope this video makes the pregnancy a better experience and a more memorable one, and the women should enjoy this wonderful experience without the fear of anything. Thank you.